Rushanara Ali.
Thank you, Madam Deputy Speaker. I want to start off by paying tribute to all those in our NHS and across local communities, including in my constituency, for everything they've done to support people during this pandemic. And my thoughts are with all those who've lost loved ones. And as many will be aware, Black and minority ethnic groups and those from socially disadvantaged communities have been hit the hardest by this pandemic, with Pakistanis and Bangladeshis facing the largest number of deaths in this second wave. I know how hard this is, as in the last week, I myself have lost a very close relative. And early in January, we lost another beloved member of our family. This is the experience of many in our communities up and down the country. And that is why it's absolutely vital that as we move towards easing the lockdown and as we open up our schools, we make sure that families are protected and those who still have not been vaccinated, particularly those who are living in intergenerational families, who are living in very overcrowded conditions in high density parts of the country, like my constituency, are properly supported as we move towards opening up our society. And in Tower Hamlets, what we've seen is a very, very intensive effort by local providers, by the council in partnership with the Royal London Hospital, with Queen Mary University, with our GPs, our clinical commissioning group and others, the London Muslim Centre, the interfaith communities, coming together to tackle some of the reticency around people getting their vaccinations, to deal with misinformation, to deal with misunderstanding and making sure people get vaccinated. Madam Deputy Speaker, we are facing a race against time, and that's why I want to focus my remarks on what we desperately need the government to do to support local communities like those in my constituency. And what we need is the government to make sure GP surgeries have more of the AstraZeneca supply of vaccines so that they can contact local residents who they trust, who trust them, in order to get to people who need to be vaccinated who still haven't. While we've seen an improvement in the numbers, the differentials are still huge between Black residents as well as South Asian residents compared to their white counterparts. So we need to redouble our efforts, and I call on ministers to provide that extra support to local GP surgeries to get the vaccines available so that as we open up our schools, as we open up our economy, people who are still at risk can get the vaccination, can be protected.